Anne Ramoyne is a professor of epidemiology at the UCLA Fielding School of Public Health. Appreciate you joining us.
It's my pleasure.
So the World Health Organization is warning that the latest outbreak of Ebola is a public health emergency of international concern, and it comes after a delay in reporting the outbreak in the Democratic Republic of Congo and in Uganda. What do we need to know about this specific strain of Ebola?
Well, this specific strain, the Bundibugyo strain of Ebola, is in many ways similar to the Zaire strain, what we've seen in other wide-scale outbreaks. The difference here is that this particular strain does not have vaccines, therapeutics, and frankly diagnostics that make it easy to detect it. The problem is that you need a much more sophisticated laboratory to be able to actually identify this strain, because the more common kinds of diagnostics that we use in the field for Ebola Zaire do not detect this strain.
So, and the World Cup is not far away, which means a lot of people will be travelling right across the globe. How will this outbreak be contained and controlled, given there is no vaccine to stabilise this particular strain in Central Africa?
Well, Rosemary, I don't think that this is necessarily a threat to the World Cup. This is something that's happening in Central Africa at present, but we do need to get in front of it. And it is a reminder that an infection anywhere can potentially be an infection anywhere in the world. And so what we need to be able to do is to make sure that we throw everything at this to be able to contain it. It is now, we know that there are chains of transmission that have occurred that we missed because the diagnostics don't work very well, and they missed all of these cases that have been transmitting for the last month. We need to make sure that there can be good surveillance and contact tracing and diagnostics deployed to places so that more of these cases can be detected. And we need to have the treatment available for people, even supportive care, which is the only thing that really works in this scenario to date, available to the Democratic Republic of Congo and to Uganda and to any other countries that might be affected.
So what would be happening there in Central Africa right now, and what do people generally need to be doing and looking out for to protect themselves in that particular region and beyond?
Well, it's important to remember that Ebola is spread through close contact with individuals who have Ebola, and this is pretty well documented through all of the outbreaks that we've had. And it's, this again is a strain that we've seen before. This isn't a strain that we haven't seen before. It's just something that we didn't anticipate or didn't have the tools to be able to anticipate quickly in place. So, what I would say is for people who are in Central Africa and in the region to, make sure that if they're ill, that they make sure to let somebody know if they've actually been exposed to a case of Ebola. I think that's, in particular important for healthcare workers who may be working in this region. I also think that that what we really need to be worried about is how we're actually going to contain this in the area. And the way to be able to do that is to have good coordinated international response, to be able to empower the Congolese and the Ugandans to be able to get out there and to do the work that they need to do. These are both countries that have dealt with Ebola outbreaks previously. They are the experts in being able to do this, but what they need are the resources brought to bear and all of the technical support from countries all over the world to be able to get in front of this.
And hopefully they'll get that support. So what are the symptoms of Ebola? How is it treated? And what should people be looking out for in terms of early symptoms?
Well, Ebola is a very serious disease. It's a filovirus, and it's called a viral hemorrhagic fever because it's something that actually can produce hemorrhaging, but that's in the later stages. The early stages are, fever, fatigue, headache, gastrointestinal symptoms, vomiting, and then it can progress further to the kinds of serious symptoms that we've seen associated with viral hemorrhagic fevers, including bleeding.
Let's hope this gets contained sooner rather than later. Anne Ramoyne, thank you so much for joining us. Appreciate it.
Thank you for having me.